Welcome, everyone. It's really nice to see you all. And today we're going to be talking about hormones 101. What are they and why do I feel like this? Because many of us do not feel adequate when our hormones are not balanced. And as you could probably figure out, today we're going to talk about mostly about female hormones because we have more hormonal fluctuations as women, and maybe because we're entering a Mother's Day weekend, and mothers usually have even more hormonal fluctuations than younger women. So that's why I want to dedicate this presentation and this lecture to all the mothers and all the women who deserve to live healthier and deserve their hormones to be balanced. So therefore, we're going to go through the material. I'm going to present my little lecture, and then we're going to pause. I'll turn off the video, and you can ask me questions that you have. So we're going to talk about hormones, some of the quick hormonal facts, and what are the different types of hormones we have? What are the good hormones, the bad hormones? Are they all good or all bad? And we're going to talk about hormonal imbalances. What are the causes, the symptoms, the treatment, and we'll end up with some of the questions and answers and announcements about the practice, what's new in our practice. So if you don't know me, my name is Dr. Elena Klimenko. I'm a physician in Manhattan, and I graduated medical school in Russia in 1994, and shortly after moved to the United States, where I became American licensed physician, and I got board certification in internal medicine. However, during my training, I was really disenchanted about conventional medicine approach to chronic medical illnesses, as well as hormonal imbalances that women face in their lives. So I started looking for my tribe of practitioners who back then called alternative medicine. So along my journey, I received a certification in medical acupuncture, clinical homeopathy, and finally I arrived to functional medicine in 2007 with intense training. I received the certification in 2014 through the Institute of Functional Medicine, being one of the first cohort of practitioners worldwide who decided to dedicate their professional career in medicine to functional medicine. So ever since then, in somewhere in 2005 until now, I've been learning about hormones and trying to understand all the intricacies of the hormonal balances. And I'm still learning. I just actually graduated a course, 6 months course, which is the college course or medical school course of University of Florida, dedicated to learning how to prescribe hormones for women and men of all ages. And of course, my personal interest, my personal self-care brought me to even more practical and deeper understanding of hormonal balances. So we always learn better when we apply it to ourselves. So I definitely guilty of treating myself and balancing my own hormones. And it helped me a lot to understand my women as well, my patients and women. So today we're going to be talking mostly about female hormones. And of course, there's so many different facts about hormones and the balancing of hormones at any stage of women's life. Anytime from the puberty to the pregnancy, to the premenopausal, perimenopausal, and menopausal life, hormones are extremely important for women's health. And hormones, as you know, really everywhere. They are like a little messengers all the time, sending the message, like a text message through their group of their social media. They dictate and they send the signals to every cell in our body. And that network that you see on your picture is just a vague representation of what hormones do to all of us. and how the hormones communicate the messages from organs to systems to every cell. So that's why they are so important, and balance of the hormones is even more important. So, and they are so sensitive. The hormones in our body are extremely sensitive and reactive to any internal and external body, external stimuli. And it reacts extremely fast. And we all know how our stress hormones are responding to any stimulation. For example, stress, how quickly we mobilize to react to the stress, but also how stress affects our female hormones and how it can affect our periods, either bringing it quicker or just an opposite, delaying our period. So they are extremely reactive and responsive. Of course, there's some bad reputation for the hormones. Some hormones are, we think they're bad, but they're not bad. It's all about achieving the balance of that you need to live healthy and optimal life. And as you can see, there's some this picture represents that the balance between thyroid hormones and cortisol and DHEA and estrogen and progesterone, testosterone, it's all like a symphony of their different hormones. And if the violin plays too loud or too low, you cannot hear the music as beautifully as it could be. The same thing with the hormones. If we have too much estrogen or not enough progesterone or too much cortisol, that will affect the whole network of the hormonal balancing. So remember that it's about the balance. There's no bad or good hormones. It's about the balance. So, and as you probably know, their hormonal synthesis in the body is controlled and start from the brain. So a lot of the hormonal health based on the mental health and on their activities and environmental factors that affect our brain. I'm talking about adequate amount of sleep, adequate amount of nutrition, adequate amount of positive emotions or negative emotions, right? So all of that will affect our hormonal balancing. It's all starting from the brain, but also structurally, how important it is for us to have adequate circulation to the brain. Think about our neck that brings the blood to the brain. And if we're sitting at the computer all day and we're jamming our circulation, we are actually affecting our hormonal balance. And that's why it is so important to have a proper posture for our hormonal balance, maybe get proper chiropractic adjustments or osteopathic manipulations, because all of that will affect our hormonal balance and the brain health. So the stimulation to all the hormones in the body comes from their master regulator, our brain. So we have over 50 different hormones in the body. So it is a lot. This whole picture of endocrine system that starts from the brain in the cortex and then involves hypothalamus and pineal gland. And then the signal from the brain goes to their glandular organs or endocrine organs. It's our thyroid, it's our thymus, it's our pancreas, it's adrenal glands, it's ovaries, testicles in male. All of that will be the instruments, you can say instruments in their orchestra of our hormonal symphony. So some of the hormones you probably heard of, like cortisol or insulin, also a hormone that regulates the sugar, or cortisol, the hormone that stimulates our reaction to stress. And believe it or not, we cannot survive without cortisol for too long. Our estrogens, of course, for so important for our female balance and female health. And we have different estrogens, estrone, estradiol, and estriol. All of them have a different function in the body. And of course, their progesterone that controls the balance of estrogens, so important for our sleep, for our brain health. It's protective against the breast cancer and the uterine cancer. So, and testosterone, so important for our libido and energy and the muscle mass production. Of course, DHEA is the precursor of cortisol, and testosterone is also very much important, and the levels are usually overlooked. And finally, the thyroid hormones. The thyroid stimulating hormone, or T4 and T3, those are all the hormones that we are testing when we want to evaluate your thyroid health. An interesting fact, and you probably didn't know that men and women have the same hormones. We all have testosterone, we all have estrogens, and we all have progesterones. Though women might have more estrogens and progesterone than men. But testosterone is important for women as for men, progesterone and estrogen. It's all about amounts, right? So if testosterone is known for being a male hormone, it doesn't mean that women don't need it. Because if we lose our testosterone as women, we stop growing our muscles, we do not rebuild our bones, our brain might not function as great, we are feeling much more inflamed. And the same thing with men. They need estrogen for their brain function. Men need progesterone to feel calm and relaxed and not feel worried and anxious. So it's all about the balance. But we all have the same hormones, believe it or not. So hormones aren't bad, but they can have a bad reputation or symptoms when they are out of the balance. And this is why I believe thorough health history and testing is important. And we utilize variety of the testing in practice. Beside the blood test, we also utilize urinary tests for hormones, as well as saliva, which is extremely important to adequately analyze their tissue level of the hormones. So before I replace any hormones for my postmenopausal women, I always like to test the saliva because it really represents the tissue level. And certain hormones like cortisol needs to be tested adequately through the saliva when we can collect 4 samples of saliva throughout the day. It's really difficult to get someone to the lab to check the blood 4 times a day to get an adequate representation of the cortisol throughout the day. But with saliva, it's relatively easy. So that's why it's so important to see a practitioner who knows how to test the proper hormones. So again, back to the notion of bad hormones or good hormones. So you need glucose and insulin to live, then we know that. But if you have too much of the glucose or too much of insulin, you are at risk of the diabetes and insulin resistance. And that's why the balance is so important. So while we need insulin for adequate amount of insulin to keep the glucose level under control, too much is not good in this case. And we need estrogens for the brain, for heart, and for bone health, and of course for reproductive health. But too much of it can cause symptoms like PMS, breast tenderness, extremely painful or heavy periods, or lack of progesterone can make estrogen to be inadequately high. So again, balance and counterbalance of those hormones. So what are the common symptoms of hormone imbalances? First of all, fatigue. And fatigue can be not physical only, but also mental fatigue, or inability to multitask. That something used to be so easy, right? Now it is a chore. It is a problem. That could be a problem with thyroid or cortisol, again, estrogen, progesterone, and you're allowed to have multiple hormonal imbalances that could be responsible for a specific symptoms like fatigue. Or weight gain, especially the weight gain that is in the midsection of our body, strongly correlated with cortisol imbalances. Trouble falling asleep or staying asleep, right? We didn't mention melatonin, which is another important hormone produced in the brain with the onset of the darkness. So if we don't have a proper balance of serotonin and melatonin, we might have a problem of sleeping. An interesting fact, actually serotonin, which is a neurotransmitter, is not a hormone, actually will be converted to melatonin. So if we don't have enough serotonin and we have a poor mood, then our melatonin will not be produced. So really, really important to understand all the intricate relationship between our chemicals in our body or chemistry in our body. Menstrual problems, PMS, low libido, or some skin problems like dry or oily skin, itchy skin, acne, and of course the hair health, thinning of the hair, dryness of the hair. All those things, believe it or not, will be related to hormonal imbalances. Some other common symptoms is, of course, gastrointestinal problems, bloating, gas, constipation, diarrhea. Some people who have too much of thyroid hormone will be having a lot of diarrhea and a lot of anxiety. When an opposite, when the thyroid hormone is inadequately low, people will be constipated. They will not, they will have a dry skin and loose hair. Mood disturbances. Of course, depression, anxiety, panic attacks, all of those symptoms can be strongly related to hormonal imbalances. Fertility problems, racing hearts or irregular heartbeats, obviously in menopause or perimenopause, hot flashes and night sweats. And those symptoms could be expected in the transitional period of the women's life when they're in perimenopause. But I see 60, 70, 80 years old women having those night sweats and hot flashes, mostly related to inadequate balance of estrogen and progesterone. Brain fog, memory problem, as I said, mental fatigue, inability to do their losing executive function for women is extremely related to estrogen, inadequate amount of estrogen. One of my teachers who just recently, my mentor, Dr. Pamela Smith, who wrote a lot of books about their hormone replacement therapy, and she's herself being proud of being 70 years old and still keeping a very vigorous life and professional life, seeing patients, teaching. She would say that there's no age limit for women to start hormone replacement therapy if she wants to preserve her brain cells. So even 80 years old, even 90 years old can preserve their brain if they're ready to do and go through the work that needs to be done to be on the hormone replacement therapy, which was a new concept for me, because I'm glad that conventional medicine now acknowledges the importance of hormone replacement therapy, but of course they're recommending it only for the transitional period. I think European society now, gynecological society, is advocating for 10 years after the women's life, because they now have enough studies to show that, yes, it improves the quality of women's life after 10 years from menopause, but it's actually ongoing benefit. So, but it has to be done properly. It has to be done very conservatively, so women are not overdosed on the hormone replacement therapy, as well as the hormones should be balanced. It's not about just giving more of hormones and make a woman of 60 or 70 years old with hormones of 18 years old. That's not the goal. It's they're just sending enough signal for the brain, for heart, for the bones to do the proper job. And also, so other things about the brain and memory and burnout and feeling stressed could be signs of their adrenal insufficiency or adrenal inadequate imbalance, which is so common because it's one of the first hormones that is actually becoming out of balance in a women's life. So if any one of those symptoms sounds like you're definitely in the right lecture. And I'm sure you can learn something from this lecture and maybe apply for yourself. So the hormonal imbalance can be caused by number of different issues. Of course, stressful life. Who is not stressed in nowadays, right? Emotional stress, mental health, mental stress, physical stress. Being mother, God bless all the mothers out there, is the stressful event in life. Sleep disruption. If we do not sleep, we cannot recharge our brain. We cannot adequately function next day. And of course, our circadian rhythm will be disrupted. And therefore, all the hormonal secretion will be out of tune. Blood sugar imbalances. So, of course, what you eat, how often you eat, is extremely important for the hormonal balances. It's actually recent studies show that people who eat very late at night will block their melatonin production. So, and therefore, their sleep onset will be delayed, which tells us the importance of eating in the adequate time. And of course, eating too much sugary food will cause a problem with their insulin and glucose regulation. Remember, insulin is one of those hormones that is intimately connected with all other hormones. Illnesses, infections, chronic inflammation, chronic viruses, yeast, bacteria, mold, mycotoxins, as well as exposure to mycotoxins through the food could be also causes of the hormonal imbalances. Gut health issues and problems, any signs of gut imbalance, anything from heartburn to lack of appetite to constipation or diarrhea, bloating, all those symptoms can be related to hormonal imbalances as well. Exposure to endocrine disrupting chemicals that we are all probably exposed through the air, water, food supply, of course, heavy metals, exposure to their plastics that act like estrogen or hormones in our body that lead to so many problems in women's life, specifically like fertility issues. And it's so ubiquitous now that women, even in their childbearing age, 25, 35, have a really difficult time to get pregnant because they have a history of xenobiotics, or what we call the chemicals or plastics that are endocrine disruptors. Chemicals affect a hormonal balance in women's life. And interestingly, in men's life, you probably heard that present level of testosterone in modern man is about 20% below what it was even 50 years ago. So men are losing their testosterone and women actually gaining the testosterone from their endocrine disrupting chemicals. And that's why we have an epidemic of PCOS and endometriosis and other hormonal imbalances. And of course, there's a medications that can cause side effects of the hormonal imbalances. I just saw a patient today, male patient, who was receiving steroids injections for the acne or for the alopecia, which is the loss of the hair, a local loss of the hair. And nobody explained to him that this local but regular steroid injections into the skin can affect his hormonal balance. And meanwhile, he's growing the hair on his beard, but his testosterone is now so low that he's stopping being a man. He doesn't have any drive. He doesn't want to get a new job. He doesn't want to get a new girlfriend or any girlfriend. He's just in this isolation state, which is, the signs of low testosterone. So medication is really important. That's why it's so important to take time to take adequate history in patient's life. So you have probably been told that hormone changes are normal or expected. For example, women after childbirth, or women in during the time of the menarche, when they're just getting their period and the hormones are not balanced. And so doctors are trained to say, oh, let's just take birth control pills or another medication, maybe like a antidepressant, and that will help you. So it's normal. Well, it's not normal. We're not created this way. We created to be balanced with adequate balance of hormones. But our environment, our lifestyle makes us to be abnormal, but it is not normal and not expected. So I want to just go over a couple of cases. This is a Maya. She's 35 years old, and she presented with a fatigue and hair loss and depression. And she's been feeling this way since the birth of her second child a year ago. She stopped breastfeeding at 1 year, but her cycles are still irregular, which is strange. Her primary care doctor told her, well, this is expected with the two children under the age of 5. You're tired because you're a mom with two toddlers, so it's okay. And she advised her to join a Mommy and Me group to get some communal support and consider taking some antidepressant medicine. Maybe it will boost her energy. But and I am all pro communicating with women with a similar problem. So Mommy and B is excellent. But it is really important to sit down and talk to the person. So we sit down with Maya and completed a full history and physical, which took about 90 minutes of our initial visit. And we did the blood test with the thyroid hormones, ovarian hormones, iron panel, vitamins like vitamin D or B12, and prolactin. So it's really important to dive really deep. So primary care doctors, they're great at screening through the problems, but they're trained to check thyroid only with 2 hormones, when our panel in functional medicine probably has about 9 hormones of the thyroid and 9 markers of the thyroid to evaluate the thyroid hormone function. So with Maya, her TSH was normal. And that's what usually primary care doctors check. When they evaluate the thyroid hormone, they just check TSH and T4. Those are the 2 hormones they're checking. But when we checked her full panel, it showed that she has actually their thyroid hormones were all on the lower side. TSH was still normal, but remember, TSH, or thyroid stimulating hormone, comes from the brain. It comes from pituitary gland, and it's a signal from the brain to the thyroid gland to make thyroid hormone. So that her pituitary did not send the adequate signal to the thyroid hormone to produce enough T3, T4. Maybe that's why she was losing her hair and was depressed and was tired all the time. So TSH is only the marker for the conventional medicine, but this misses so much else. The low thyroid can cause all those symptoms that she was presented with. So ordering the right test is also very important. Luckily, here we see more and more primary care doctors becoming much more proactive, and they do check that, but they're still missing some of the markers. So interestingly, her prolactin, which is the hormone that stimulates the production of the milk, prolactation hormone, was slightly elevated. Despite to the fact that she is not breastfeeding for a year, her prolactin was still increased. And increased prolactin can actually cause low thyroid hormone and cause irregular cycles. That's why women postpartum, after they deliver babies, might have an irregularity of the cycle, because that prolactin will suppress the adequate amount, the adequate secretion of the hormones. It's kind of like a body's protective mechanism not to get pregnant while you're breastfeeding. So there are actually ovulation and other hormones can be suppressed by prolactin. But in her case, even though she stopped lactating a long time ago, she still suppressed, she still had a slightly elevated prolactin level. So we had to support Maya's thyroid hormones so she can become, her thyroid function can become normal again. And And then we also learned from her diet, from her history, that she's been a vegetarian for quite a while. So when we checked her B12, vitamin B12 is the vitamin that comes from their animal products, from meat, eggs, poultry. And so when women deprive themselves of those products, they usually develop B12 deficiency, and B12 is irreplaceable nutrients for energy production and for mood and for depression. So many women who, and men, of course, if they get adequate amount of B12, they will feel so much better, energy wise, mental health wise. One of my teachers always joke that if we just can hang B12 IV in a nursing home, half of the nursing home will walk out on their own, because all they need is maybe just adequate amount of B12. And you, by the way, you cannot overdose on B12. It's a water soluble hormone, vitamin, so you can excrete it through the urine. Whatever your body doesn't need, it will excrete. And back to Maya, her glucose and insulin were also higher than ideal, because when you are a vegetarian and you kind of eat beautiful vegetables that are on the picture, but you're missing satiety dictating nutrients like meat or adequate amount of proteins like fish, you tend to overeat carbohydrates, right? You overeat bread, you overeat baked goods or starchy vegetables, because that's the food that makes you feel full. It helps with your satiety. So as a result, her glucose and the insulin were elevated. So what did we do for Maya? We recommended her to adjust her lifestyle. We put her in protein shakes, which is easy and quick way for mom of 2 kids to get the nutrients on board of her health, of her body, and keep stabilize that sugar level. That also will support her stress reaction, and it will lower the stress hormones. So she will start sleeping better, and it will help to manage her sugar level. We also gave her some supplement and support for thyroid and B12 supplementation. So, and then of course she had a significantly better outcomes, and she stopped losing her hair, her depression went away, and she was much happier. It's a very common case, by the way. I see plenty of women postpartum and before they get before the conception, so we can help to balance those hormones. But even more common, I see women in their mid-50s, when they entering menopause or premenopause, when they start developing irregular period. So this is the case of 53-year-old woman with irregular periods for the last 12 months. So she is in this perimenopausal state. She's still getting her period, but now she noticed that she started gaining weight, especially in the midsection. She is feeling much more tired. She used to manage multiple priorities in the same day and worked through the day, came home, took care of the family. Now she feels exhausted when she comes from work. She doesn't even have a mental stamina anymore. And she started developing these joint pains. And most importantly, she wants her sleep back. She can't sleep anymore. She can't fall asleep. And if she falls asleep, she wakes up multiple times throughout the night. And when the alarm goes off, she's exhausted. So what can we do for her? Well, first, we need to know what your lifestyle looks like. She actually skips breakfast. She eats protein bar during the day for her lunch. And at dinner time, she eats standard American diet. That's what I wrote, sad. Her dinner is sad. So she'll pick up pasta. She takes out some pizza for her family because she doesn't have time to cook. So we checked her salivary hormones, and guess what? Of course, her estrogen was low, her progesterone was low, but testosterone was still normal. Her thyroid tests were all borderline low. Maybe that will explain her fatigue and weight gain and maybe joint pains. When we checked her cortisol on the 4-point cortisol testing through the saliva, it was very low in the morning and higher in the middle evening and at night. As a result, she can't fall asleep. When your cortisol is going up at night, your body is ready to wake up and do things. Finally, when everybody is asleep, that's when the woman gets that second wind, right? And she goes and she starts working. If that sounds like you, probably time to check your cortisol level. But in the morning, she's exhausted. She cannot get up. She needs like 5 coffees to get going. So what did we recommend? We recommended for her to have an adequate diet. So change from standard American diet to more of the Mediterranean diet. And if she doesn't have resources to cook on her own and she doesn't have adequate support at home, there's plenty of the food delivery services now, at least in New York, where you can request a specific diet, food ingredients to be delivered to you. And I find it some of my patients find it very helpful. But we also taught her and helped her to develop a routine of ordering the food and groceries online so it can be delivered on the regular basis. So she doesn't even have to spend much time on that. Of course, the lifestyle, adequate exercise changes. So she doesn't have time to exercise, but maybe she can find time to go for a walk in the park or take their walk instead of taking the subway or the bus, or maybe walk the stairs, be active, ask for their standing table or desk at work. And we support the stress level. We supported the inadequate cortisol by giving her adaptogenic herbs in the morning and maybe calmative herbs at night, so she can adequately relax and enjoy her sleep. We'll help her to manage some sugar levels. We started her on estrogen and progesterone since those were low after adequate screening with mammogram and pap smear, and gave her adequate nutritional support. Also, for women who choose to do the bioidentical hormone replacement therapy, eventually we like to see their genetics and see how their genetics support the hormone's metabolism. We're also looking at how women metabolize the estrogen, because now we see the correlation of some women metabolizing estrogen in their unsafe way that can increase the risk of cancer. So we can definitely modify it with their proper lifestyle as well as proper nutritional supplementation. So those are the 2 cases of the women that I see on the regular basis. Younger women whose hormone need to be balanced, either it's a PCOS or endometriosis, and women who are going through the menopause or are in menopause and they just want to balance their hormones so they can continue to live adequate and optimal health. So if you are not yet my patient, or even if you are, schedule the discovery call with my team, and so we can explain in more details how you can become our patient and what is the process of becoming a new patient, how we take patients from the initial visit, from the moment you schedule an appointment to their moment of the first appointment, which usually takes 90 plus minutes, and then working with my health coaches, helping the patient to implement the changes that need to be done for a better health. So feel free to scan this QR code so you can schedule their discovery call with my team. And as thank you, and as a congratulations with their Happy Mother's Day, and for all those women who are listening to me today, feel free to take advantage of this excellent bundles that we prepare for you. This is one of my favorite, which is the protein shake with protein and multivitamin in one serving. So it's basically your daily multivitamin, and the fabulous greens, which is a great source of antioxidants. Get this coupon. You can get this bundle with a 15% off until the end of May. Excellent way to start your day for busy moms, to fuel your busy morning with the protein-packed shake and antioxidant powder. So this is actually commonly my breakfast. At least 3 days a week, I have protein shake with everything that I have in my kitchen, and maybe some berries. I blend it, I drink it, and I'll take my morning supplements. It takes me literally 3 minutes to have my breakfast ready, and I know that I am fueling my body with the adequate amount of protein and nutrients that I need to go around about my day. And for those of you who already know Best Breakfast Complete, there's a great bundle to grab 2 of those protein shakes at their discounted price. Just use the code COMPLETE15. And then, of course, for our mom's wellness, there's a high protein powder, which is supporting not only your protein level, but also adequate detoxification function of the liver and supporting your gut health. One of my favorite advanced detox liver and GI support protein shake that provides you 24 grams of protein, as well as you don't want to leave your home and go out into the stressful world without your adequate amount of B vitamins. B complex is so essential for us to protect our brain and increase our resilience. And of course, omega-3 fatty acids are so important to keep the inflammation low throughout the day. So this is a great bundle if you are looking for something that is really quick and easy to support your health. Great gift for our moms, great gift for our sisters, and our nieces, and all the women in the family. So use this hormone 15 code if you would like to utilize this discount. Okay, and I would like to remind you that our health starts in the gut. All diseases begin in the gut, as Hippocrates said, but the cures of many diseases also starts with the gut. And that's why functional medicine, that's what functional medicine taught me, that our health is so much relied upon healthy gut functioning. And that's why in my practice, we start with the gut and we always come back to the gut. For patients who've been with me for several years, they know that we periodically check the gut. We use the stool test, very advanced stool test called GI map, that is looking at not only a microbiome, but also immune state of the gut. It looks at how adequately you digest your food, looking at the markers of their of adequate digestion or food sensitivity, or markers of the leaky gut or increased intestinal permeability. So please join us for this program, the Whole Gut Wellness Program. It's my first digital course that I recorded because I am tired to repeat the same thing over and over for each patient. So we created this program. So for 2 hours, I can teach you how to take care of your gut on your own. But then we developed also a program where you're supported by not only my health coaches and Marina Kucher, who is another certified functional medicine practitioner, but also by me. So this is actually a great way to get support. Listen on your own time, Whole Gut Wellness Program, but then also get support in the group setting from our practitioners. And you see my health coaches here and Marina. So if you're interested, feel free to scan this QR code to get more information about Whole Gut Wellness Program that will help you to deal with leaky gut, get started you on treatment of autoimmunity, or just boost and support overall gut health. Gut is so, so important. So never underestimate the importance of it. And because you're here today, you'll get $50 off. So you can join us for Whole Gut Wellness Instagram broadcast channel. And remember, this is another excellent bundle for those who suffer from constipation, the GastroFlow and triple magnesium. All of those bundles you can find on my e-store. And I just want to remind you that this is their allergy season, and we have a unique treatment in the practice performed by Mark Bystad, who is an acupuncturist. The SAAT literally helps people to get rid of the allergies without any pharmaceuticals. Only 2 treatments is required, the initial treatment and then the follow-up in 30 days. And we've had literally miracle cases of helping people to get rid of their severe allergies. This treatment involves insertion of the small, tiny acupuncture beads or needles in the specific area of the ear. So you can read about SAAT therapy, or just call us and Mark will be happy to discuss it with you. It's obviously very minimally invasive treatment. It has a broad spectrum application even for alpha-gal, which is their intolerance of red meat. We have several success stories for alpha-gal treatment, variety of environmental allergies, animal, dandruff allergies, substance allergies. It has a really high efficacy, close to 90% success rate, and it's highly customized, obviously, and long lasting. So the treatment is geared towards immune system modulation and reprogramming immune system through their acupuncture points on the ear. Again, 2 sessions, and you can significantly decrease the need for allergy medications and maybe even get rid of your allergies. And I'm reminding you that you want to refuel your body with the nutrients. IV therapy or intravenous therapy is an easy way to deliver nutrients straight into your blood, into your tissue, bypassing the gut. And we do a great deal of different IV therapies. So we are offering for the first time, if you never had IV, 15% off to this great treatments. Try our Rejuvacell that repairs at the root. It actually repairs the cellular membrane. You can also just do the Myers cocktail, or that will be modified specifically to your needs. Or just high dose of vitamin C is so great to recover from the cold, flu, and boost your energy. So call our office if you would like to schedule your intravenous nutritional drip. Reminder for those who have results of 3x4 genetic testing, the next session will be on May 19th during the lunchtime. It's always on Monday of the 3rd or 4th weekend. Those of you who are my patients already aware of it, but if you are new, you can definitely start your journey to functional medicine with this test. Just contact our office. And for those of you who are in Miami or in Florida, I started seeing patients in Florida. It just happened that so many of my patients moved to Florida during the pandemic that I decided maybe I need to go and see them there. So now I see patients there maybe once every 2-3 months. So just for your information, if you want to see me in Florida, you can do so as well. And of course, we are still open to the new clients. So if you're already a patient of our practice, but you have a family member who can benefit from functional medicine approach or to this root cause approach to their health issues, please refer them to us. We'll be very grateful. It will be a great compliment to us to see your friends and family. And at this, I want to thank you all for attending this traditional monthly live Q&A. And as a thank you, I want to offer you to use the code that gives you 10% off for the entire store that you can find at this at this link right here, shop.drlenaklimenko.com. You can also find my shop by going to my website. So take advantage of this 10% off for the whole entire store.